Hello everyone, a very good morning and welcome to the AM MedTalk series. This is Shriyal, the editor of Aesthetic Medicine India, and I have joined you once again for our live today. Another doctor joining with us live, another new topic for all of us to discuss. But yes, before that I have to ask you this, that have you registered? Have you registered for the Aesthetic Medicine Conference and Exhibition 2025 happening in Mumbai on May 17th and 18th at NESCO? My team and I have been totally busy with the preps. We are very excited to bring to you 3 conference halls and expanded exhibition space. We are going to be discussing topics around aesthetic dermatology led non-invasive treatments. We also have a hall that is focusing on hair aesthetic plastics. So let me add her in quickly into this live. Your invite to join into the live, and I have accepted it. So we will have Dr. Sravya join us soon. But yes, we've been putting all the updates related to our event on our Instagram page. If you need any more details, you have any more queries, you can always DM us and we will share the same with you. But yes, I look forward to my team and I look forward to seeing all of you at the live. Dr. Sravya, I hope you have received my invitation to join me live. So Dr. Sravya Tipirneni is from Bangalore. She's going to be joining me today for a very, very interesting conversation. Yes. Hello, doctor. Good morning. How are you doing?
I'm good. Thank you so much for having me.
The pleasure is all ours. Thank you so much for accepting our invite to join us on the AM MedTalk series.
Thank you so much. I look forward to imparting knowledge in a very simple fashion.
Absolutely. So I'm sure, like always, I am all set with my questions. And for everybody who's joining us in this live, I have left the comment box on. So do leave your questions for Dr. Sravya as well. We will take as many as possible during the live. And of course, this live will be saved on the Aesthetic Med India Instagram page as well as on Dr. Sravya's Instagram page. So any questions for us, even post the live. If you watch it later, please do leave it in the comments and we will come back to you. Before I get on to my questions, so what is our topic of discussion today and what am I going to be discussing with Dr. Sravya? So before that, Dr. Sravya is from Bangalore. She's a consultant dermatologist, cosmetologist and trichologist from Manipal Hospital. And I think this is the first time ever I'm having the opportunity to have a live interaction with her. So that makes it even more exciting. So Dr. Shravya, just before you could join in, I was also telling everybody we have our annual show coming up in May 17 and 18, and we have doctors across India coming at the show. It's a blend of a conference and an exhibition space. So of course, I would look forward to you blocking your calendar as well and joining us on May 17 and 18th in Mumbai.
Definitely. I'll definitely look forward to that.
Awesome. Having said that, what is Dr. Shravya and I going to be discussing today? So very interestingly, we are going to be talking about biostimulation to stimulate collagen production and improve skin texture. So as I mentioned, I've come with my set of questions for this and I'm going to jump straight into it. So Dr. Shravya, shall we begin?
Yes, definitely.
Superb. So I would actually like us to start with the basics that, what exactly is biostimulation and how does it help in improving skin texture?
So, to make it very simple, like the name says, bio is your own body or biological, and stimulation. So, you're stimulating your own body to regenerate something that is degrading with age. So, that is the simplest way I explain to patients as well. Why do increasing aging concerns or skin concerns come post 30, 35? Is because there are certain degrading components of the skin, mainly collagen, elastin, and your fibroblast activity that decreases. In common terms, what do we see? More fine lines, more wrinkles, more sagging, loss of luster, my skin is looking dull. All of these complaints have a very root cause of bioregenerative capacity of the skin to heal itself, to produce more supple, nice skin. So that is called biostimulation, where you're trying to do it again.
How does it actually work in the skin? If you can, just elaborate a little more, and what makes it such a key part of the anti-aging and skin rejuvenation process?
So number one, there is collagen. That is the building block or the most important part of the skin structure. Fibroblasts produce collagen. So in the chemistry, when you study about it, there's a whole process of neocollagenesis, which means new collagen synthesis. So all of that relates to the supple structure or the feeling of suppleness of your skin, the non-sagging, tight firmness of the skin that's brought about by something else called elastin, which is easy to remember, I think. So if your skin is supple and smooth and soft to pinch, it means it's more elastic. So that's elastin. And fibroblast activity. These form the main components of youthful looking skin. So why is it important in this day and age where everybody is so conscious? Awareness has increased, education about being healthy, and healthy options for anti-aging, more importantly, have increased. And people are moving away from traditional, slightly older, yet reputed safe methods such as Botox into more naturally stimulating your own body to grow younger kind of methods. You know, Brian Johnson has been in the news for everything. That is a whole body regenerative capacity. This is, we're talking about biostimulation in the skin. So the dermal layer of the skin houses these components, and whatever you inject, which we're going to talk about, is going to in directly or indirect manner stimulate the same collagen, which has probably slowed down because of age and other factors, so that your skin can regain its supplety that maybe you saw in your skin 5 to 10 years back.
Absolutely. Yes, yes, yes. So, what are the most commonly used biostimulators today? And if you can also tell us, and how do they differ from each other?
Yeah. So the most common and the safest, I would say, is plain hyaluronic acid. Now, hyaluronic acid is a very vague term and it's a very versatile term. Let me just say that. We can use it to lift, tighten, contour. People are scared these days because there's something called a duck face which comes with hyaluronic acid when done imperfectly. So let's not like use that term very freely. Hyaluronic acid in the lab, when a particular cross linking is done, when a particular structural molecular weight is given, is very fluid. So hyaluronic acid is my number one choice, and generally also to stimulate collagen, and it also hydrates the skin in the process.
Hmm.
So that is number one. Then calcium hydroxyapatite is one more which is used. It's known as Radies all over the world. It's slightly longer lasting. It is slightly more time taking as well to show results. After you inject, you have to do a couple of sessions, 2, 3 sessions, a few weeks or months apart. And then you have to inform the patient that, listen, you are going to see results only after 4 to 6 weeks or 8 months,
Yeah.
or a couple of months, not 8 months, because it's a slow
Hmm.
process. There's one more very popular trade name is called Sculptra, but then what it actually has is PLLA. And what this does is it also decreases the fine lines, wrinkles, it's more structurally there, longer lasting, and can last for 2, 3 years, but the result starts showing only after 4 to 6 months. And you
Okay.
need about 2, 3 sessions 4 weeks apart. So these are the most common. There are other new biostimulators coming up, but the most commonly used ones, if people have heard the names, are Profilo in
Ah,
India
yes,
at least.
yes.
Yes, Volite, Skin Weave, and these are the ones
Okay.
which are usually done in a very safe fashion, um, provided the patient is a fit mentally and physically.
Right. So I was coming to that next. And how do you determine that, the patient is a right fit for a biostimulatory treatment?
I think first education and awareness, Shriyal,
Absolutely.
because I feel people just expect very differently than what the product does. So, first of all, understanding the patient's expectations is super important. If somebody is looking for a brightening glow treatment just before a vacation, this is not something I would do.
Ah,
They
okay,
would
okay.
just be so disappointed with it,
Hmm.
right? This is something you invest in long term. This is for your skin health and rejuvenation long term. Does it give immediate results? No. Do you feel a little hydrated and plump immediately? Yes, because there are two components. For example, I inject a Profilo. Number one, you're injecting a hyaluronic acid at the dermal level in a particular technique at particular points. So it spreads out. There's a whole mapping to it.
Hmm.
It has to stimulate an allergic reaction little bit inside, inflammatory reaction, not allergic. And then it has to stimulate the fibroblasts to produce new collagen, etc., which is definitely going to take 4 to 8 weeks. So
Hmm.
you start seeing the results only after 2 to 3 months. The
Ah, right.
tightening part, the plumping part, and the I don't know, not lifting really, but the texture part. But hyaluronic acid also hydrates. So do you feel really nice hydrated, with that radiance? Yes, that you will see in like a week. So there's always two components. So when I talk to the patient, I think all the doctors have to be brutally honest. It's very important in aesthetics, especially where there's a lot of difference between the patient expectations and what the doctor is trying to do. So I would say choosing an ideal candidate who's educated and aware is very important, and unreal expectations. If they bring a
Right.
celebrity photo and say, listen, can you make me look like this with a biostimulator? No. I mean, it's different things where you have to do
And I think
in order to
patient
achieve that.
satisfaction is also very important, and that's where your point comes in, that why it is important at the consultation stage to keep their expectations very realistic.
Yes.
So a lot of times if that consultation does not get right, then even though you know the result will show
Yeah.
in say 2 to 3 weeks or whatever, but the patient is not aware, so they will make a mindset say within 2 3 days of getting the treatment done, that, oh, I cannot see
Yeah.
the result I expected to see. So yeah, I think like you rightly mentioned, that education, awareness, and creating that transparency in the consultation stage becomes very important. Also, any specific skin type, or the fact that they would have recently done some other treatment to the face that you are a bit more cautious about while you are planning to do a biostimulatory treatment for them.
Yeah, I mean, I think the first contraindication comes up in the basic medical history, Shriyal. I mean, obviously, if you're planning pregnancy, if you're breastfeeding, lactating, you have any autoimmune diseases, you have a whole other medical condition going on, if you're under chemo, I mean, all these are basic medical history, which I'll say you're not a candidate. I don't think it'll do you much benefit,
Hmm.
right? You have to be transparent about it. Secondly, as far as procedurally I'm concerned, let's not do too much in a day or in a week, is what I say. If they've
Right.
undergone some kind of ablative procedures, whether it's lasers or something else, give the skin time to heal, even though it's at a different level. Or if they've undergone, like micro needling Morpheus, for example, super popular. Everybody comes asking for it, not even knowing what it is. Um, so things like that, I would say, please give that one inflammatory response time to go down, and then we can plan it 2 3 weeks later. So again, in the medical history, what have you done? What are you suffering from? What are your drug allergies? All of that
Hmm.
has to be taken into consideration, and the age, amount of sagging of skin, all of that also, obviously.
Right.
I'm not
Right.
going to be able to magically lift a very saggy 65-year-old woman's skin with biostimulators. So,
Absolutely. Absolutely. Do you also usually combine biosimulation with other treatments like lasers or microneedling? So is that also something that you do? And how does that give a value added result to what you are looking forward to?
very much. I think the best results come when you're treating from inside and outside and all the layers. Let's just say that. It's like a piece of cake. It has so many layers. The skin, epidermis, dermis has two more layers, three more layers, then there's the subcute. So I feel, yes, combination treatments work the best. There's no one solution fits all kind of a thing. I mostly combine it with Morpheus, microneedling radio frequency procedures, or you can do a mild collagenesis with collagen stimulation with Q-switched NDAGs, which is more superficially done. Those two you can combine probably even on the same day. And apart from that, if they're getting deeper fillers for structural reforming and everything, or just, Botox in general, all of those can be done on the same day. Botox does its own thing, biostimulatory fillers do their own thing. So, yes, combination always works best because everybody wants better texture, more even skin tone, as well as structural changes such as reduction in fine lines, reduction in wrinkles, reduction in sagging, all of that. Everybody
Hmm.
wants
Hmm.
the whole
Absolutely.
package. Yes.
Yes, yes,
So we have to combine.
yes. So right at the beginning, you did touch upon when we spoke about realistic expectations that, when can they expect for the results to show after they undergo a treatment on an average. If you can also talk about what's the usual treatment timeline. So how often do patients come in? And of course, when do they start seeing results? You have already said, but on an average, how many sittings? How often do they have to get it done? If you can talk about that as well.
Usually like the PLLA and the hydroxyapatite, I said 2-3 sessions, 4 to 6 weeks apart. Results start showing in say 3 to 4 months. Calcium hydroxyapatite, we don't do that much in India, but around 1 to 3 sessions with similar intervals. Hyaluronic acid based ones like Profilo and Skin Volite and everything. Initially, you do 4 weeks apart the first time, and then you just have to do it twice a year. And so it carries forward. And this is also because we can't stop aging. We can only not look our age, and we can push our skin into thinking it's anti-aging a little bit and providing that nourishment and stimulation from inside. But usually, if you ask me, the most apparent changes come in 3 to 6 months after the injection
Hmm. Hmm.
on an
And
average.
right. And considering that there are a lot of products in the market, I mean, the market is flooded with offerings. How do you make the choice? Like, what are the factors you take into consideration, and how do you decide that which product needs to be used in the practice?
Same things we spoke about, Shriyal. Patient expectations, patient's age, patient's longevity of results, like what are they expecting? How long do you want it? Depending on that, you can choose the biostimulator as to how long they want it. The patient's skin type and characteristics. How saggy is it? How many wrinkles? Has it been Botox before? And
Hmm.
combination of treatments. I think if they are combining it, you require a little lesser quantity.
Hmm.
If they're not combining it and they are only doing this as a sole treatment, then there's more pressure on the one product to perform better. And also the product I choose depending on the rheology of the product also, like there's a different type of cross-linking, there's different molecular weights of the hyaluronic acid. There's so many things that you have to learn about. As far as we doctors are concerned, we have to learn about the chemistry of it. So then you can sort of, you're very enlightened about what suits which person better. Once you know the chemistry, only will you be able to understand how it's going to set in a particular phase. Most people
Right.
ignore that. Of course,
Right.
the cost considerations. These are very expensive products, even for the doctors to procure. So let's not ignore that fact.
Absolutely. Can you also tell us a bit about your injection technique? So,
Mhm.
do depth or placement really make a big difference in the result? And what is your technique about?
Yes. So each filler has a different technique. Either it's with a needle or a cannula. The depth is usually dermal. The depth is usually dermal. But for example, if I'm doing Profilo, so we use it for the dorsum of the hands, right? So I'm not going to sit and poke everything if a person is okay with it. Some people are more okay with needles because they're very scared of looking at the cannula even though it's blunt. They think it's a longer needle, right? So the psyche of the patient also matters. So with one cannula point, I love cannulas. One entry point, you do a cannula technique. There's fanning techniques, there's a drop technique. Profilo, for example, has BAP technique where there's bioaesthetic points, which are the anatomically chosen points from research where you just give it in one go, like 5 points on the face, about on each side, 10 points on the neck. It spreads out throughout. So, yes. So you have to use whatever points are specific for that particular molecular weight of cross-linking polymer to spread out.
Hmm. Hmm.
So it's
Uh,
different. I mean, it's tailored to individual needs also. It's customized. Sometimes if a person is more has more loss of volume around the eye area, even though the bioaesthetic points say, listen, put this much, this much, this much here, I will concentrate more here because she probably doesn't need that much on the jawline. Things like that. So once you start practicing, I think the more number of patients you treat, you learn to customize it so well.
right, right, right. So I was recently reading an article on, like when we talk about trends and everything, that how now you see the Gen Z getting into these treatments much faster, and we're seeing a change in, how early people are ready to even undergo such treatments, because of course the exposure to virtual reality is more, the exposure to now being more social in a world is more. And I think that's one of the factors. But in your experience, have you seen a shift in who's asking for these treatments? Also, one is in younger patients, like we just mentioned, or also if we talk about the postpartum women looking for skin rejuvenation, are you seeing a shift in who's asking for these treatments in terms of age group?
Definitely. I have postpartum women asking me, give me everything I can use in lactation. Okay, I'm the one who has to stop them. And children, not so much. Teenagers, yes, they're much more aware and they read up. They're educated. They come with clever questions, intelligent questions, let me just say that. So I can't just brush them away and say, listen, you're 19. I was told, by the way, by I think a 18 or 19-year-old who was asking me for a biostimulator. I said, see, honestly, there is nothing wrong in giving it at that point. It's not going to do much damage. It's not a very hard, hyaluronic filler. But how did you get interested in this? And she gave me the examples, okay, of like two, three celebrities, including J Lo, and said, "Do you see how certain women looked at 50 and how she's looking at 50? That has to be me." I said, "Fair enough, right? How do you debate that?" So generations have changed, times have changed. People are wanting to groom themselves, take care of themselves, especially women. You're not bound to the home or the kitchen anymore. Everybody is
Absolutely.
financially independent. I think that plays a very, very huge role in wanting to take care of yourself. And I find absolutely nothing wrong with that. As long as everybody is in the safe zone and nothing is done unethically for a very young person. There are those practices also going on. We all know it. So I am brutally honest, or I reject certain teenagers or patients who want something that I feel they don't need. In their perspective, they want it. They can go to somebody else. I will not do it, is what my blunt answer is. Because I don't want to, my conscience has to be clear. But
Yes.
yes, I feel it's a good thing and a bad thing, but mostly good. They're taking care of themselves. Their age will show up much, much later.
Yes.
So it works. It can't not work.
Yes, absolutely. Thank you. Thank you so much, Dr. Sravya. I'm done with my questions, and I think I have tried to cover every aspect of what we could write, from the consultation stage to the treatment, the type of treatments that we can look at over here, combination treatments, of course, we spoke about. And I think you have given me answers beyond my questions. So I even skipped a few on my list because I knew we already covered them. But yes, for everybody watching us, I am sure you have got what you could get out of this talk. Yet we will be saving this live, because I can see some of you have just joined in between, some of you are just joining in. So don't worry, we are going to be saving this live, and you can see it at your time over the weekend. And if you have any more questions for Dr. Shravya, as I mentioned, use it in the comments, and we will respond to it. So having said that, thank you so much, Dr. Shravya. We look forward to having many much such lives with you going forward. And of course, I would look forward to even meeting you in person soon, either when I'm in Bangalore or you are in Mumbai.
Yes, definitely, Shriyal will do more.
Yes,
Thank you so
thank
much
you
for
so much,
having
and
me.
have a good weekend.
Bye.
Oh, 1 second. I think we have one question that has come in, so I'll quickly take it. I think I missed one or two right at the start, but we can take this one before you leave, doctor. It's about the under eye dermal filler, though. That, can you tell us the depth of the under eye dermal filler?
So the under eye is a more complicated area. So there's a tear trough, then there's a malar mound here, then there's the infraorbital part of the maxilla, the bone here. So if you're injecting on the this area for the support, usually we give the support first here. It has to be on the bone. So there's periosteal level of dermal filler done for the under eye region. And there is dermal filler just in this gutter region, which is called the tear trough region, which is supposed to be not immediately under the skin, but say the dermal layer. Okay, so there's different areas. Some are on the bone, some are above the bone, some are in the fascia. Like when we try to lift from here, we go in here with the cannula, that's not on the bone, that's on top of the parotid fascia. So that's in the fat pads as well. So there's under eye is two components. One is periosteal, one is not. So depends on who's treating your under eye and what your concern is.
Yes, Aisha, I hope that has answered your question well. And always the doctors say, I've heard this time and again, that you go consult your dermatologist and they will be the best to decide what is needed for your concerns. Okay, so having said that, Dr. Shravya, I'll take your leave now and look forward to communicating with you soon.
Yes,
Have a
definitely.
great
Bye,
weekend.
guys. See you.
Bye. Bye.